KFWB News Talk 980. This is Dr. Chambers on call, here every Saturday morning, keeping you healthy without that dreaded copay. 888-539-2980 is the number to call. That's 888-539-2980. Now, you go to your doctor and quite frequently she prescribes you a medicine. Do you ever wonder about what things are going through her mind when she's actually going to make that decision? Like, what drug should I give Juan? What drug should I give Albert? What drug should I give Mikukito? Is there a difference? Well, traditionally we've looked at a variety of factors. Age, very important. There's some drugs you can't give to a baby. There's some drugs you can't give to a teenager, like the quinolones, the ciprofloxacin, which is drugs we use for urinary tract infections. You can't give those to teens. Affects their bones and so forth. So age is a big factor. And as you get older, we tend to decrease the dose that we give you because your body just doesn't quite deal with it as well as when you're younger. Simple fact. Some people get angry about this. I had a woman who was almost 80 said to me one day, "This is my second visit with my urinary tract infection, young man. And the last time, you gave me half the dose. Don't want that. I want the full dose. I want the whole thing. I want to get rid of this." And I laughed and said, "Okay, I get it." But as you get older, you get the full dose, you're more likely to get side effects. That's why we decrease the dose. Of course, weight is a big factor. I see a lot of parents treat their kids like they're kids. But the kid sometimes is heavier than me. And they've given them a baby dose. So of course the medicine is not working. Most of what we dosage is based on your weight. If you're 250 pounds, we got to dose you that way. Different than if you're 100 pounds. Think about it. It's a bigger space. A 250-pound guy, he's going to eat more than a 100-pound little woman. But they're going to need more medicine too. They're going to need a lot more medicine. And the other thing that we look at is ethnicity. Now, we know, for instance, that, say we're dealing with hypertension, that African Americans do better on a group of medicines we call calcium channel blockers. Caucasians do better or do as well with less side effects on medicines called ACE inhibitors, lisinoprols. We know all of this. We know it. But what about if we could do some tests that said not only these are the drugs we should give you, but these are the drugs we shouldn't give you? Think about that. Think how magical that would be. If we could do a test that says, if I give Esperanza this medicine, she's going to get this side effect, so I can't do that. I cannot do that. And I want to delve into this a little bit more. I want to talk about how your genome is affected and how people are studying this to say, hey, maybe when you're treating Joe Chambers, you shouldn't give him this medicine because he's going to have a little problem. But let me take one more call. I'm going to talk to Barbara in Inglewood. Hi, Barbara. Hi, can you hear me?
Yes, I can.
You have a question for me, Barbara.
Well, last week I went out to clean out my car.
Yeah.
So I sat down backwards so that I could reach in the back of the car, and in the interim, I hit my head on the car.
Sure.
I hit the back of my head, and I'm wondering if I should. And today is whenever I cough, my head hurts, and I'm wondering if I have a concussion or should I go.
Well, let me ask you a few basic questions about the event itself, Barbara, before we make a decision. Did you lose consciousness when you banged your head?
No.
Did you have a headache immediately or subsequent, or in the hour or so after?
Hours, days after.
Days after. Okay. And did you behave funny? Did your family comment that you weren't your normal self?
No.
Do you have any speech problems, like you want to say the word but you can't quite find it, or you can't understand what somebody is saying to you?
No, I don't.
Are you on blood thinners?
No.
So you're not taking Plavix or Coumadin or aspirin?
No.
No.
I'm African American.
Mm-hmm.
I have no high blood pressure. I have no high cholesterol. I have none of that. I have nothing wrong with me.
And there wasn't an open wound where you banged your head? There wasn't a cut or something? No?
No.
That's good. And we're about a week after the event. Is that what you're saying?
Yeah.
Well, I think, Barbara, that you would be a really good candidate if you were concerned at the time of banging your head to go to urgent care. Because if you came in to see me in urgent care, all the questions I just asked you would be all the questions that I would ask you. And then I would do an exam. The first thing I look for in the exam is there a cut, is there a laceration, is there a problem where you banged your head? And then we do like what we call a little neuro exam. It's not, in an urgent care setting, we do not have 45 minutes to do a neuro exam. We have approximately 5 to 7 minutes at most. So we do a brief neuro exam. But we really base it on the symptoms. And the symptoms we look for are, is there loss of consciousness? Is there blood thinners? Are you behaving normally? So if you came into me, I would not have scanned you last week, Barbara. I would have just put you on what we call head injury precautions. And what that means is we would have talked to you and your family and said, this is what's happened to Barbara. We need you to keep an eye on her. If she gets a severe headache that won't settle down, if she behaves differently, if she behaves funny, if her speech goes off, you've got to bring her back. And we list them, and we give you this all in writing so you can look at it during the night. And of course, the bad part of all this, Barbara, is we say to people, you got to wake her up every 4 hours for the first 24, occasionally 48 hours, just to monitor it. That's what we tell people. And we do all of that because we want to avoid the dreaded CAT scan. And you know why? Because there's so much radiation in these scans, it's scaring us now. There's so much radiation in these scans, they're actually causing cancer because we're using them too much. So this is one of the things that we brought in. Now, I recently had a young kid who had a severe concussion, and he was disoriented. He didn't quite know who he was or where he was when I saw him. And I sent him into the ER. Because it was about 7, 8 at night, and I didn't have access to a scanner myself. We do during the day, what we don't after hours. We send them over to our ER. And the ER doc saw him and didn't want to do a CAT scan. I thought, like, really? You guys CAT scan toenails as they walk through the door. You don't want to, this guy is 50 and he's confused. What is wrong with you? Yeah, are you crazy? So what happened there was very straightforward. The mom says, well, his dad, a lawyer, he's wondering, should he have a CAT scan? So guess what happened? He got a CAT scan, which was normal. But I had to admire the chutzpah of that emergency room doctor, because I didn't have that chutzpah. I wanted to scan that guy, and I didn't know his dad was a lawyer. Because he was young, he was disoriented, he was confused. So the long and the short of it, Barbara, is I don't think you have that much to worry about at this point of the game. And even if you had a very mild concussion, and if you have a concussion, it's really on the mild end of the spectrum. We wouldn't do any intervening things. We would just treat the headache. And generally speaking, what I like to treat headaches like this with is just Tylenol. Or if you prefer Advil, which is generic, I often prescribe ibuprofen. But take adult doses and take them on a routine basis. And adult doses is about at least 500 milligrams, probably a gram 2 to 3 times a day, and no more than that. And if that's not controlling your headache and it's not settling down, then you can check with the local urgent care or your primary care doctor. They'll take care of you. But this is a really good question because people are listening now. They're saying to themselves, you know, 5 years ago, Barbara would have probably gone to the emergency room and gone through all that and be scanned, which was not necessary. 888-539-2980 is the number Barbara called, and you can call me with whatever is on your mind about you or your family's health. 888-539-2980. When I come back, I want to talk about the newer concept of looking at your genotype, at your genes. Yes, believe it or not sci-fi, current day stuff. What your genes tell us about what drugs you should avoid because you might get a nasty side